So we were talking about what happens when antidiuretic hormone is absent or is not being produced effectively. You remember we were talking about Sammy the baby, that she has to pee, and ADH makes sure that she doesn't pee too much because ADH stands for antidiuretic hormone. So in adults who have a problem with ADH and they're not making enough, they would end up having something called diabetes insipidus. This is characterized by the fact that they pee a lot, which is called polyuria. And because they pee a lot, they're losing a lot of water, they're dehydrated. So they have to drink a lot. Which is called polydipsia. So they have to take their cup and dip it a lot to drink. Now, polyuria, pee a lot. Pee a lot. Now, diabetes insipidus is characterized by polyuria and polydipsia. Diabetes because they have to keep on sipping a lot. But they don't eat a lot. So there is no polyphagia. And that's what makes it different from diabetes mellitus. Polyphagia, to eat a lot. Diabetes mellitus, I'm going to do something. Diabetes because it has to do with food, the meal. Alright? Alright, so let's go back to what's happening with Sammy. So she pees, her mom changes her diaper, she doesn't pee too much because of antidiuretic hormone. Now, Sammy is eating, so she has to grow. Growth hormone regulates her growth. But the rate at which she grows is regulated by, or it is facilitated by, thyroid stimulating hormone. Thyroid stimulating hormone goes to the thyroid gland. In the thyroid gland, it causes the release of thyroxine. Thyroxine is the drill sergeant of the body. Now, I'm going to briefly go back to growth hormone and talk about its side effects when it is absent or too much. Then we'll jump back to thyroxine. So, let's say Sammy is producing too much growth hormone. What would happen is, as she's growing, she'll grow faster than all her other age mates. At the age of 5, she might be 5 feet tall. At the age of 10, she might be 7 feet tall. And that's significantly abnormal. So, excessive growth hormone causes a condition called gigantism. And in the opposite, if there's little growth hormone, she'll be short, in which case she'll be considered a dwarf. Now, growth hormone does not have significant effect on a person's intellect. So she'll be smart as a whip, but she'll be short in size. As opposed to thyroxine, on the other hand, thyroxine, we said, is the drill sergeant of the body. It can influence a person's intellect. And we'll talk about its side effects.